Back in the country, Cabinet Secretary Cleopa Mailu and his Principal Secretary Nicholas Muraguri jointly appeared before a parliamentary committee to answer to queries on the alleged loss of billions at the Ministry of Health. The two appeared before the National Assembly's Health Committee once again appeared to contradict each other, raising more questions than answers. Timothy Otieno was following the proceedings for us.
Health Cabinet Secretary Cleopa Mailu and Principal Secretary Nicholas Muraguri for the first time appeared side by side before the National Assembly's Health Committee, seeking to shed more light on alleged misappropriation of funds at the Ministry of Health. And here, it appeared blame would quickly be shifted by the two to the internal auditor Bernard Mushere, whom they say did not conduct a thorough assessment of financial records in his report.
When you are preparing vouchers, I thought before payments are made, the internal auditor is supposed to be part and parcel of the system. At what stage does he also become now to play the oversight role?
Usually there is a role which they play, but on a day-to-day basis, every payment, in my view, does not pass through the internal audit department.
The committee once again raising queries concerning 100 portable clinics purchased by the ministry, 99 of which was still lying idle at the Mombasa port.
What caused the ministry to pay for goods which are still at Mombasa and they have not yet reached their final destinations?
They are portable clinics. And the ground which is being prepared, you make a slab because they will be placed on a slab. You bring water, electricity, and other social amenities, and then hopefully we do some prefab building for the staff who are going to use them.
You have a budget, isn't it, that you are working with? So how much is it costing you to prepare those grounds? Okay, in total then, for all the 100?
The final assessment is still being finalized because we are also still debating with some members of parliament on the location of some of the sites.
So that means they are not mobile clinics, because if they are mobile, they should be deployable at short notice to any ground, anywhere in Kenya, wherever they are needed.
The two are in trouble over allegations that up to 3.1 billion shillings was looted through diversion of funds and double payments of goods and services under their watch.
Of payment.
They insisted that the audit was interim and that due process had been followed by those concerned. The committee evaluated the alleged diversion of funds meant for free maternity to other sectors without Parliament's approval. 889 million shillings from that kitty is believed to have gone to payments to various suppliers without the necessary approvals in a meticulous manner as part of the alleged multi-billion shilling scam.
Issues have been raised here, and I want to say the basic principle. If all these educated people and these Kenyans don't stick to the truth, Kenyans cannot move. Kenyans will die. Kenyans will die. If all of us here, both sides, cannot stick to and stand by the truth at any cost.
The committee prematurely cut short its session after the cabinet secretary said he was not feeling well and needed medical assistance.
The committee will remain for a few minutes.
The legislators now plan to head to Mombasa to probe the utilization of the mobile clinics that still remain at the port, with a final audit report into the matter expected to come from the ministry in a week's time. Timothy Otieno, KTN News.